Okay, so welcome back. Let's talk about this vaccine story because this has ramifications, and it could be a terrible ramifications for us all, but especially for babies. Dr. Frita is a triple board certified medical doctor with certifications in nephrology, hypertension, and diabetes. She's a host of the Dr. Frita Show right here on very popular Dr. Frita Show right here on YouTube. Dr. Frita, welcome to the program. When you hear the Health and Human Services Secretary who's his handpicked vaccine committee scheduled to vote today on whether to change longstanding recommendations that every baby get vaccinated against hepatitis B within 24 hours of birth. What do you think?
I think he's going to cause millions of Americans to lose their lives. It's not an exaggeration. It's not hyperbolic. We know, Don, that the hepatitis B vaccine has saved lives. So we could just look at the data. We look at the data. We know that prior to 1991, so prior to that hepatitis B vaccine being required at birth, we had 18,000 cases of hepatitis B in children. After 1991, fast forward, now we only have about 20 cases per year. And we know that hepatitis B can cause liver failure, cirrhosis. It can cause patients to need transplants, cause them to have ascites, cause them to have bleeding problems. It's really a disease with high morbidity, and we have a safe vaccine that has worked for decades. And here's the real thing, Don. He has no data. He has no data, no evidence to support him. And so if you have mothers who leave with their babies who don't have vaccines, well, if you're a mom who has means, if you have money, if you have transportation, sure, you can go back and you can get the hepatitis B vaccine. But it's really going to affect mothers who have low income, who are in rural areas, and it is going to affect lives. He's supposed to protect our health, but he's going to cause more deaths, no question.
He is now in the position of influence in the federal government, weighing in on these public health decisions. And Dr. Frita, he's still playing games with conspiracies and pseudoscience. It is unclear whether this panel, called the Advisory Committee on Immunization Practices, or ACIP, could significantly delay or eliminate that so-called birth dose of the shot for babies whose mothers test negative for the virus. The group tabled a vote on the vaccine in September because some members called for a more robust discussion first. Now, does this give you some sort of hope that they may not change it, that, you know, cooler heads will prevail? But even now, doctor, I mean, that we're even in this position discussing this is problematic.
It's very problematic, Don. And sadly, and I'm an optimist. I really am the glasses half full type of a person. But when RFK Jr. took this position, the first thing he did was fired all 17 members of the ACIP. These were members who were tried and true. They were scientists, and they were pro-science, pro-health, pro-evidence. So he fired them. And so now we have a new batch of handpicked ones, many of whom have had anti-vaccine rhetoric. And so that makes me not so optimistic that they would do the right thing. And he's still making changes as far as the people making health decisions. And he's choosing people who have a history, again, of anti-vaccine rhetoric. And so I'm not very optimistic just based on the history of the people in the committee. And the fact that we're even talking about it is ridiculous. There's absolutely no evidence. It's a safe vaccine. It saved lives. And if you talk to anyone, you know, I did my internal medicine pediatrics residency at Georgetown University Hospital. And so I saw patients, kids who had hepatitis B, who had liver failure. And even now, as a kidney doctor, hepatitis B is one of those viruses that can lead to kidney failure. And so the health ramifications are endless when it comes to getting hepatitis B. The prevention is simple and safe. This is dangerous, and this is just the beginning. Okay, this is the tip of the iceberg. He's going to do more. He is doing more to ruin the health of this country.
Yeah, look, I don't think you can say it any plainer, and I want to be plain here. When people cannot protect a newborn from a preventable virus, I don't think that you can be taken seriously as a leader. I mean, this is the man that Trump empowered in the Department of Health and Human Services, somebody who questions the foundation of modern medicine, someone who floats ideas that, excuse me, Dr. Frita, that makes scientists around the world put their heads in their hands. And we live in America, the most advanced nation on the planet, I believe. And it's, look, there's a larger thing here. It's all connected, I believe, a president who elevates misinformation. But when that misinformation is, if we're looking at the possibility of it, what they're investigating today, the person that they have arrested, right? There's all a connection here, elevating misinformation, getting people riled up. But this one has a more immediate danger to the larger society and not just some people who are at the Capitol. Sadly, that's important. But
Right.
this can affect the entirety of the United States, if not the world, because we don't live in a place where borders stop diseases.
Exactly, exactly. And when you're in administration and you're not willing to protect the most vulnerable among us, the babies, then who will you protect? And we know that this is not a right, left, Democratic, Republican issue, because even when you look back at the hearing for RFK Jr. and you had like the senator of Louisiana, who was a physician, questioning him and making him promise not to mess with the vaccine schedule, you know that people who actually voted for him to have him confirmed, RFK Jr., knew better. You know that many of the intelligent people, you don't have to be a doctor, you know better when it comes to vaccines saving lives, just like the measles, the mumps, the rubella that he's separating. You know that we had millions of deaths before the vaccine, and then we eradicated measles, but now we have the highest cases of measles that we've had in over 30 years. Everything is lining up that RFK Jr. is wrong about vaccines. And you look at whooping cough at pertussis, we have the highest number of cases of whooping cough that we've had in decades. Everything points against him, yet due to the leadership, RFK Jr. is still being allowed to ruin the lives and take the lives of Americans. If we don't wake up now, I don't know what's going to happen.
Yeah, and look, and to your point, all right, any change could have wide-ranging consequences. This is according to the reporting, and this is something that you said. I just wanted to bolster what you said. Some public health experts say that having fewer newborns vaccinated against the virus could risk an increase in chronic infections among children. Hepatitis B, which can be passed from the mother to the baby during childbirth, as you said, can lead to liver disease and early death. There is no cure. We have a vaccine, and this is a quote from Neil Manier, a public health professor at Northwestern University. We have a vaccine that is highly effective at preventing an incurable disease. We should take full advantage of that. The birth dose recommendation was introduced in 1991 and is credited with driving down infections in kids, Dr. Frita, by 99% since then. Manier called that a remarkable success story, and we run the risk of reversing if the committee changes the recommendation.
Absolutely. And you note that RFK Jr. and Trump, they love to label the hepatitis B virus saying, oh, it only affects people who are promiscuous. It only affects people who are drug dealers. Number one, those people have the right to have high quality of life also. But even if you were to believe that, it's not true, because you have many nurses who get hepatitis B, doctors who get hepatitis B just by trying to save lives. You have people who don't know that they have it and they can pass it on to their babies unknowingly. Okay, you have caretakers. There's a reason why we had 18,000 cases per year of hepatitis B in children before the vaccine. It's because it was out there, it was being passed to children through no fault of their own. Now we have a safe way to prevent it, but if you take that away, especially with no evidence, we're headed down a slippery slope. He's already trying to mess with other vaccines, and he's falsely stating that things like the COVID-19 vaccine, he's saying, oh, it's caused death in children. You know what caused death in children? The COVID virus itself did. He's trying to mess with the other vaccines. It feels almost ridiculous to talk about it because the evidence is so highly stacked against what RFK Jr. is doing. And, you have to look at the top. If he weren't allowed to be in this position, we would not be having this discussion. And so I look to our leadership. I look to President Trump, and I look to the various Republicans who voted RFK Jr. in to do something, because now you're playing with people's lives, literally. So this hepatitis B, removing the vaccine in children, it's going to have consequences. And so if we don't unite on this one, then things are going to continue to get worse. And now we're talking about babies, we're talking about lives, we're talking about death. I can't stand it.
Dr. Frita, thank you so much. I appreciate you taking the time. I know that you're very busy. You're working. You have patience.
Yeah, I'm in office.
Yeah, I can see that you're in office. Thank you. All right. We'll see you soon. Be well.
All right. Thank you.
Dr. Frita, everyone.